Good morning, everyone. My name is Shamsidin Giwa. It is my pleasure to have all of you here to listen to my presentation on how to check the blood sugar level using the glucometer, diabetic test strip, and the lancet. That are the three main devices needed for this process. So let us start the process. I believe that all of us here have come across a diabetic patient with ages ranging between 18 and 30 years. Is there anyone here that is out of these parameters? Since there is no one out of these parameters, we continue. The purpose of this presentation is to acclimatize everyone here to self-check their blood sugar accurately and in a safe way. We're going to start by introducing the glucometer to us. This is a device that is advocated in international guidelines for diabetes management. It was developed from electrode system in 1962, although the first glucometer did not appear until 1986. And despite known discrepancies between glucometer readings and actual blood glucose levels, SMBG provides immediate results, making it crucial in medical settings where lab tests can take days. These three devices can be purchased together at any pharmaceutical store. It is important to understand how to use these devices safely and effectively. A glucometer is a device used to measure blood glucose level. It is a portable device that allows individuals, especially those with diabetes, to quickly and easily check their blood sugar levels at home or in a clinical setting. The device works by analyzing a small drop of blood, typically obtained from a finger prick, to provide an accurate reading of glucose concentration in the blood. Let's talk about the test strip. These strips are essential tools for monitoring blood glucose level in individuals with diabetes. They are available over the counter at pharmacies, online, and through subscription services. These strips work with glucose meters to measure blood sugar level by reacting with a small blood sample. A lancet is a small sterile needle used to obtain a blood sample for glucose testing, playing a crucial role in diabetes management. To use glucometer strips correctly, we have to follow the standard medical step. First thing and foremost is to wash your hands with warm soapy water and dry them completely, because residual moisture or food particles can cause inaccurate reading. How do you do this? After you wash your hand, you insert the strip by removing a test strip from the vial and immediately closing the cap to protect the remaining strip from humidity. You insert the strip into the meter to turn it on. Then you prick your finger by using a fresh lancet in your lancing device. You prick the side of your fingertip rather than the pad to reduce pain and obtain an adequate sample. After that, you apply the blood by touching the tip or working edge of the test strip to the blood drop until the meter's confirmation window is full. Then the last step is reading the result. The meter will count down and display your blood glucose level. You have to record the result in a logbook or in a digital tracking app, depending on your doctor's recommendation. That's an important tip. You always check for the expiration date on the test strip vial because expired strips can provide false readings. How do you use the lancet? Wash your hands with soap and warm water, dry them completely. Prepare the lancing device, turn the cap counterclockwise, and pull it off. You insert a new lancet into the device until it snaps into place. Then position the lancet by holding the lancing device between your index and middle fingers. Place it against the side of the finger you wish to prick. You have to activate the lancet by pressing down on the button until you hear a click, which will release the lancet to make a small puncture in your finger. Then you collect the blood sample. You have to wipe away the first drop of blood and collect the subsequent drops as needed for testing. Tips for a safe and efficient blood sugar check. Since fingertips are highly sensitive due to the numerous nerve endings, making blood sugar testing sometimes uncomfortable. To alleviate the pain from finger pricks during glucose check, you have to consider alternatives. The first one is you use the side of the finger tip rather than the tip itself. Check the device specific instruction for any recommended alternative site for testing. Avoid alcohol wipes for cleaning. Instead, wash your hands with soap and warm water to minimize irritation. Also, warming your hands before pricking can also help reduce sensitivity. Additionally, alternative finger or testing site can provide some relief as well. Using a fresh lancet is essential as a dull lancet can increase pain and discomfort. However, if pain persists or becomes more significant, it's important to consult a doctor. How do you manage diabetes effectively? Managing diabetes effectively involves maintaining a healthy weight through a balanced diet and regular exercise. A diabetes-friendly diet includes, but not limited to, fruits and vegetables, lean proteins, whole grains, and at the same time, it is recommended that we reduce saturated fats, refined carbohydrates, and sweets. But occasionally, sugary food are acceptable as long as they are incorporated into the overall meal plan. Managing diabetes requires a comprehensive approach that involves medication, lifestyle modification, regular monitoring. With the right treatment and support, individuals with diabetes can lead healthy lives and reduce the risk of complications. In conclusion, the frequency of blood sugar monitoring depends on the individual's treatment plan. Those on insulin may need to check their blood sugar level up to 4 times, while people with type 2 diabetes not not using insulin may monitor their level less frequently. Continuous glucose monitors are available to reduce the need of finger sticks and can also provide available trend data to help track blood sugar level over time. Despite care management, blood sugar levels can fluctuate due to various factors, including food, exercise, medication, illness, alcohol, stress, and hormone. Regular A1C testing is recommended to assess average blood sugar levels over the past 2 to 3 months. This provides an overall picture of how well treatment is working. According to the American Diabetes Association, ADA, it is recommended that a target A1C of below 7% is required, though individual goals may vary based on factors like age and other health conditions. This is the end of my presentation. Does anyone have questions or concerns? Okay, thank you for attending this presentation.